Before she worked with the State Cancer Registry and Comprehensive Cancer Programs in Colorado. She was also a contractor with the Cancer Surveillance Branch at the Center for Disease Control and Prevention. Kathy has worked on numerous projects related to both cancer survivorship and the communication of cancer data over the past decade. She holds a Master of Public Health degree from the University of Colorado, Denver, and currently lives in Kansas City, Missouri. In the past 2 years, One Health Insights has worked with the Wyoming Cancer Coalition to develop the latest version of the statewide cancer plan, as well as the Wyoming Cancer Survivors Needs Assessment, which she'll be discussing today. Without further ado, help me welcome Kathy.
Hi, everyone. Star, give me a thumbs up or let me know if you can hear me all right. And I am also going to share my screen. Let's see.
Kathy, we can hear you. Sorry, it took me forever to find the mute button.
That's okay. All right. Thank you guys so much for having me. As she said, my name is Kathy Bledsoe. I've been working with the Wyoming Cancer Coalition over the last several years, and I'm going to try to tie together a couple themes of the presentations that you've already heard this morning, a little bit about the cancer plan and coalition building, and a lot of data. So I'm going to be giving the presentation today. I did leave Mac's name on the list. A lot of you have probably been working with Mac Giancola as well on this project, and I definitely want to acknowledge, he's not here today, but I want to acknowledge his participation in this as well. So without further ado, I'm going to go ahead and get started. As was said, I'm going to be talking about the Cancer Survivor Needs Assessment today. So I'm going to give a little bit of background on why we did this project, and then really spend the bulk of my time talking about the fun stuff, the results, and what we found. So first of all, why do a needs assessment for cancer survivors? So we were ultimately trying to answer the question, what resources do survivors need? So that's one of the goals of the statewide cancer plan, is to improve resources for cancer survivors. But if we don't know what the resources are that survivors need, then we can't really improve them. And a needs assessment had never been done before. So that's where we came in. We wanted to do this for a couple of reasons. First of all, is to do a bit of myth busting. We wanted to either confirm or discredit assumptions that are very easy to make, especially if you've worked in this field for a long time. The longer you work, the more you believe the assumptions that you've made. And that's easy to do, but we don't necessarily know if all assumptions hold true. So we wanted to do a wide-ranging survey of cancer survivors and hear directly from them and see what was true and maybe what was not true, or what used to be true and has changed over time. So really just doing a little bit of that myth busting. And like I said, just to hear directly from the survivors themselves. There are survivors that are a part of the coalition and the Wyoming, the survivorship work group. But we wanted to hear from as many as possible. So that's one of the reasons we did the needs assessment. And ultimately, we wanted to put those things together and use the information that we gathered to help guide our future decisions in terms of the survivorship work group and determining what those resources are that need to be improved and how to go about improving them in a way that survivors really want. So we did that in a number of ways. You can see there were sort of 6 broad steps to the evaluation that we did. We started really big scale and we tried to hone it down. So we started with an environmental scan of national websites. We looked at the sites for the American Cancer Society, at CDC, at the National Cancer Institute, and we said, what do the, the big national folks say cancer survivors need? And one of the first things we noticed is that no one mentioned the word rural almost anywhere. And so we took the list of needs from the national website And we also added on a targeted literature review and said, okay, let's go to the research and figure out what the needs are specifically for rural survivors, because that's very applicable to Wyoming and not something that the national websites really addressed at all. So then we had our research background and we pulled themes from that, and we put the themes into a survey and we sent it to the survivorship work group. And we said, here's what the national folks say is important. What do you think is important for Wyoming specifically? And we had them answer questions and say, you know, what are the biggest needs in Wyoming? And also, what do you have the ability to address in, you know, your own organization or your job? What are you funded to do? And then we had a follow-up meeting with that group and tried to align those things and get some direction on what the coalition itself could reasonably, feasibly do to address the needs of survivors. We also asked them at that point, who can we talk to for a deep dive interview? So key informant interviews are a really good way to get rich information from a small number of people, but those people have worked with dozens, if not hundreds, of cancer survivors. And so it's a good way to talk to people and get their experience. So we did some key informant interviews based on connections we made through the coalition. And then we also sent out a survey directly to survivors. And so we got 225 people that answered our survey from every county in the state. And what they were basically asked to do is review a list of potential concerns. So those could be anything from physical concerns. Did you have GI issues, for example, to mental and emotional concerns, depression, anxiety, to practical concerns. Was transportation a problem? Did you have to find someone to provide care for either your elderly parents or your own children? So those types of questions. And they were asked the question in more or less 3 levels. And this is important because I'm going to refer to it about 10,000 times throughout this presentation. They were asked, was this topic a concern at all? So was anxiety a concern at all? Yes or no? If it wasn't, then they moved on to the next question. But if it was, then they were followed up and asked, did you seek help for that concern? Yes or no? If they didn't seek help, moved on to the next question. But if they did seek help, they were then asked, how easy or difficult was it for you to find help for that question, for that concern? So was it easy, somewhat difficult, or completely impossible to find help for the concern that you had? So I will be breaking down a lot of the responses to the surveys in that way. Was it a concern at all? Did they seek help? And how easy or difficult was it to find help throughout this? So you can see that we really tried to start big and hone in on the specific needs of the Wyoming population by going to the national literature, rural specific literature, and then getting a lot of input from the members of the Wyoming Cancer Coalition, from people who ran nonprofits and cancer service organizations with the interviews, and then also the survivors themselves. So we were trying to answer that ultimate question, what do they need, in multiple ways and from multiple angles. So we talked to a lot of people, and I can't tell you every single thing that everybody said because there's just way too much. But what we did is we tried to break it down into 5 key findings. So the first one is going to be no surprise to anyone. There are gaps in resources. We knew that, and that's why we did the needs assessment. But we wanted to really dig into which resources have the biggest gaps. When we started to talk to people about this, a lot of people just said, well, I provide resources very broadly, or people need resources. But we really were able to use the survey to figure out what specific resources are people asking for. And hopefully this can help guide the works group in the future to give the types of resources that people are asking for. So the first one is financial. I'm going to go through each of these individually and talk about the data behind them. But the resources overarchingly are financial, also care coordination resources, and then mental health. So let's start with financial. I should say that one important thing about the survey, and this is really a limitation of almost all survey data that you see, there were more women than men that responded, and they tended to have a higher education level than the state average. That's just sort of a limitation of surveys in general. Women tend to answer them more frequently, and people with college educations tend to be more likely to answer them as well. So that is important because it could present a little bit of a bias in the data. However, that being said, if these people have a higher education, they are probably more likely to have a higher income as well. And yet still 2/3 of them said they were concerned about paying their healthcare bills, and over half said they were concerned about paying non-medical bills, like their mortgage, like groceries, like gas. And so if we take the assumption that people who answered this survey are actually potentially higher income than the general population, then that means the general population of cancer survivors might actually have even higher rates of financial concerns than these. So that's important to keep in mind, and presents a really big issue that needs to be addressed. Of those who said it was a concern, sought help, and then were asked that third level of questions, was it easy or difficult? Over 60% said that it was hard or impossible to find help for their financial concerns. And the experts that we talked to agreed with this. So when we talked to the survivorship work group and when we talked to the key informants, they agreed that finances were a problem and specifically called out transportation costs and health insurance as topics that needed to be addressed, that were costing patients a lot of money. So that's one aspect of it. The next was care coordination. And this one's sort of interesting. We heard it in the work group. We heard it in the key informants. We really had to sort of weave it together in the survey, because when we looked at the qualitative responses to the survey, when we asked patients, what do you want us to know? What are the things we're missing? They were talking a lot about care coordination at the same time as these, what we had classified as mental or emotional concerns. So fatigue, cognition, anxiety. A lot of people were tying those things in together with their concerns about care coordination. So I have an example. This is a quote from the survey. This person said there should be a statewide patient navigator that helps residents figure these things out. So all the things at the beginning of treatment. There's so many decisions so early and it's so overwhelming, but it can make all the difference in terms of long-term outcomes. Another person said the help available was not well communicated. I knew there was help, but I didn't understand the rules or the procedures to get it, and I was too tired to figure it out. So it felt like a lot of the people that were expressing anxiety and cognition issues, whether that be related to anxiety or chemo brain fog, they were talking about just being really tired and overwhelmed, and that making it difficult to make decisions and get care coordinated. And I know for those of you who work with cancer survivors, none of this comes as a shock. I just say this because these are the things that bubbled to the top as really the most important concerns of the survivors that answered our survey. The third component of this was mental health. So 87% of the survey respondents said that they dealt with anxiety or that they were concerned about anxiety, and 75% reported concerns about depression when they took the survey. So both the Wyoming or the survivorship work group, when we talked to them, and the key informant interviewees also discussed mental health as issues that they saw commonly with the survivor population, and not that clinical resources aren't needed, but a lot of them talked about support groups specifically being a way to address these problems. So this quote actually is more on the clinical side. But this person said, I wish they would incorporate mental health counseling into cancer treatment as a whole. It's so devastating to go through, and there really aren't many counselors to talk to in my area. So that kind of is partially that rural health piece, right? There's nobody in my area. And then also just a need for mental health services in general. So the second thing I want to talk about is that survivors don't always seek help for their concerns. I think if you remember one thing from this presentation, I would like it to be this. This is really important because this gets at the myth busting piece that I talked about. A lot of folks said that, for example, gas cards and transportation was the #1 thing they were hearing from survivors, and therefore that's where the need was. I want to point out that of all the concerns that we surveyed people about, over half of people with concerns in any of the mental or emotional health components, any of the practical concerns, and then a few of the physical concerns, fatigue, cognition, and sexual function, they just weren't asking. They were not seeking help, even though they had concerns. So we have these biases based on what we're hearing from people over and over and they're asking us for help in certain things. And so we think we might know what those things are, but I want you to keep in mind that they aren't always vocalizing all of their concerns. So this is what the data look like. You will see on the left here, all of the different topics that were asked about in the survey. So it goes from physical, practical, emotional, or mental health issues, and then each one was subdivided into these different subcategories. So gastrointestinal problems, nervous system or neuropathy problems, bladder control, all the way down to issues with family, friends, and intimacy at the bottom. And the blue-gray bars indicate what percentage of the people with concerns in those areas did not seek help. So even people with pretty, important issues like neuropathy, like nerve pain, over a third of them did not seek help for those concerns. But when you get down into, again, all of the practical problems, all of the mental and emotional problems, they were very unlikely to ask for help, even though they were concerned about the topics, to the point that if you look at intimacy, 85% of people with concerns about intimacy did not ask for help. So it's really important to keep in mind that there might be concerns that your patients and your clients are dealing with that they just aren't vocalizing, but that doesn't mean they aren't there. So why is this happening? I think there might be other things going into this, but 2 reasons I can come up with is that they're just reluctant to ask for help. So this person said, I'm a really private person and I'm not likely to ask for help. But if someone had contacted me, I likely would have been receptive to it. So this person is basically saying, if my doctor had brought it up, I might have talked to them about it, but I didn't want to be the first one to speak. I think that's a pretty common thing. Also, I didn't know where to find help. So this quote specifically from the survey really helped me reframe how I was thinking about the answers to these questions. She said, I don't think the survey really offered the correct responses in terms of, did you seek help, yes or no? It's not that you didn't seek help, it's that you weren't comfortable or you didn't know who to seek help with. So if we think about that intimacy issue, for example, who do you talk to about that? Do you talk to your surgeon? Do you talk to your med-onc? Do you go to your PCP? Do you try to get into a counselor? Like, who do you even talk to? And then are you comfortable enough to bring that up with any of them? So these are important topics because it tells us as care providers that we need to be bringing up the topics for the patients and also just kind of trying to see where they're coming from and let them know, who to go to with specific questions. I think that's a pretty easy way that we can all help guide this process for for survivors. 3, transportation might be part of a bigger problem. So it's really no surprise that transportation in Wyoming is considered to be a barrier, right? People have to travel a long way to get to treatment, especially in the winter, or if there's a windstorm, or if you have to go over a mountain pass. Transportation can be really difficult, and it is a big state with a lot of rural areas. So it's really no surprise that we were seeing transportation pop up as a key theme when we talked to people in the work group, when we talked to the key informant interviews, even when we focused on that rural aspect of the literature. Where it didn't come up was actually in the survivor survey, which was fascinating to me. Only 7% of the people who took the survey, and like I said, they came from every single county in the state, but only 7% of them said that transportation was a big concern. But in the qualitative portion, we started seeing them talk about transportation in terms of cost specifically, and they talked about expenses in general, not just exclusive to transportation. So here's an example of that. This survivor said cancer is expensive to treat, transportation, etc. Insurance is through the roof. Grants for patients or something need to be out there. It sucks to be broke over something we have no control over. So I think that's a really good example of how, for this person, transportation wasn't, it was just something to stack on the pile of problems. It wasn't the key barrier necessarily. I'm not saying that it's not for some people, but I think this is probably the most controversial finding that we had, because a lot of people push back and say, like, no, this is what we hear over and over again, the problems are. And I don't want to advocate for taking away gas cards or taking away road to recovery or, other transportation options. I think the suggestion here is to expand the way we look at financial support so that it's not just gas cards. Maybe they need a grocery store card instead of gas, or maybe they need gas, but also something else, because really at the end of the day, a lot of it is about time and cost, not just do you have a car or not. And so this is an interesting one to me. And if we have time after the presentation, I'd be really interested to hear what you all think about this one too. I have just 2 more. So the next one, I sort of alluded to this with the conversation about intimacy earlier, but we asked about sexual health in several different ways. We asked about sexual function in the physical concerns category, and then we also talked about partner intimacy and body image in the mental and emotional health survey, or portion of the survey. And a lot of survivors said that they had concerns about these topics, and the vast majority did not seek help. And for those who did seek help, it was difficult to find. So again, more data, bear with me. We're going to start on the left when we talk about how big of a concern was the topic. So again, kind of walking through these 3 levels that I talked about earlier. For body image, for example, almost a quarter said that body image concerns were a big issue for them, a big concern. 64% total said that it was somewhat of a concern. Of those that said it was at least a little bit of a concern, they were asked, did you seek help? So the 36% that said it wasn't a concern, they are not in the next column. It's just the people that had concerns. Did you seek help? We're down to only 20% that sought help. Of those that were asked, how easy was it to find help? Over half said it was hard or impossible. With intimacy and sexual function, it's similar. About half said that it was a concern. For intimacy, only 15% were willing to seek help, and 71% of those said they couldn't find it or it was difficult to find. And with sexual function, which is a physical issue that a doctor should be able to address, still only a third sought help at all. And for those that sought help, over half said it was difficult. So this is something specifically, again, that I think we need to check our biases. Just because we're not hearing about it over and over from survivors doesn't mean that these aren't concerns. It might just mean that they aren't bringing up the concerns. And so maybe the providers need to be the one to bring it up and start to address this. And maybe we can make a dent there, because I think honestly, this is pretty low hanging fruit. And so there's a lot of opportunity for improvement here. Just another quote, this woman said, there are unsavory questions that go unanswered simply because they're not brought up for the medical staff as well as the patient. The body goes through negative changes that can affect self-esteem, sex life, and hygiene. And these are areas of concern that need to be more readily addressed. Okay, and the last recommendation actually doesn't come from our survey. This one was sort of an aha moment from the survivorship work group meeting that we had. So that middle of the road, I think step 4 in the evaluation, where we met with folks and we said, what areas are you working in? What areas are important for Wyoming? And we realized that there was a lot of expansion that probably could happen within the Wyoming Cancer Coalition and the work group specifically. So for example, the most important topic to address, according to the survey, was health insurance. Everyone thought that health insurance was a huge problem in Wyoming, but no one was actually funded to be able to address health insurance issues. And so we couldn't really do anything. However, if we can expand membership, then we can bring in more resources and work in new areas. Mental health was similar. So everybody there thought resources were important and had the ability to work on expanding resources. So that's great. That's where we're going to focus in the future. Mental health at that point, and I think things have changed recently, but at that point when we did the survey, mental health was another thing. There just weren't that many people at the table that were actually funded to work on it, but everyone thought it was important. So we need to bring in new membership that can address that. And this feels like an obvious one, but engaging cancer survivors is important. We learned a lot, I think, from the survey that we did, where we heard directly from survivors about what their needs are, but that shouldn't be stopped after a one-time survey. We need to have survivors at the table constantly telling us where to go and what the needs are, because they are the ones with the needs. And you go to the community that needs it. We don't just make it up. So that's really important. And I think that's one of the things we want to address as well. So those are the top 5 key findings. The next thing we did is initiate a strategic planning process. So we are now in the process of drafting goals for the survivorship work group to figure out how to put these data into action. You know, what do we do with it? So we have 4 proposed goals. The first one being to expand the work group and increase engagement in the work group. So just making sure that we have the right people at the table and that they have the resources needed to get work done. The next one is to provide a way for both patient navigators and social workers to work together to meet the needs of survivors. That goes toward the care coordination piece that we talked about. The next is expanding access to mental health services, which would include support groups for both survivors and caregivers throughout the state. And then last but not least, we want to find a way to expand access to financial resources for cancer survivors. That's probably the most challenging one, but definitely worthwhile because of all that we heard about financial needs, both medical and non-medical. And so with that, I'll throw my email address up there. If anybody has any questions, you can feel free to email me, or if we have a few minutes before I end, then I'm happy to answer any questions right now. And yeah, I would just say if anybody's interested, definitely let STAR know, join the survivorship work group, and we are working on getting the ball rolling and making sure that the data aren't just a one-time thing, but they're actually put into action and going to be used to make a difference in the state. So with that, I will go ahead and stop sharing and invite any questions.
Thank you so much, Kathy. I'm going to go ahead and open the chat box to see if there's any questions from online participants first, and then we'll open it up for the room here. So Dr. Symington says, fantastic talk. Thank